Good afternoon and welcome to our latest Corona Covid-19 webinar for care providers in Essex. My name is Moira McGrath. I'm Director of Commissioning for Adult Social Care, and as usual I'm joined by Danny Showell, our consultant in Public Health. Danny will go through an update from Public Health. We will touch on some changes to PPE distribution, and just pick up on some of the financial support to remind you and update on some of the work on the Infection Control Fund. So I'll ask Danny to kick off.
Thank you very much, Moira. So I'm just going to do a quick flick at the epidemiology and then move on to what you do if you have a symptomatic member of staff or a resident. Things you probably know, but I think are worthwhile emphasizing again. So this first slide here is a rather garish slide, sorry about that, from Public Health England, but it shows the number of outbreaks within care homes across England, and the eastern region is the second bar from the bottom, so that turquoise bluey green color at the bottom. And you can see both the overall England picture and our regional picture has shown that there was a nasty peak and then things have come down. If you look at the last three bars, the overall in England, 114, 106, 101 cases in each of those respective weeks. That shows that yes, it is going down, but it is now going down quite slowly. If I could have the next slide, please. This focuses just on our region, the east of England. And in the last week that they have data for, which is from the 8th to the 14th of June, there were 17 outbreaks within care homes in the east of England. But if you look at the entire period from the 9th of March to the 14th of June, that extended period, 45%, just over 45% of care homes have experienced an outbreak or suspected outbreak, which shows that we have had it bad in this region. So it is getting better, but the virus is still around. We still need to be very vigilant and ready to act if it rears its ugly head. Next slide, please. So what happens if you have a staff member with symptoms? So firstly, what are the symptoms? These you'll know: a high temperature, a new continuous cough, and the added one was a loss of sense of smell or of taste. Any of those symptoms, no matter how mild, could be the signal that a person has the virus and they need to self-isolate. They need to not go to work and they need to self-isolate. How long do they need to self-isolate? Well, they need to stay away from work. They need to stay away from work for 14 days. The guidance is 7 days if you have symptoms, but we've extended the guidance locally to say 14 days. The reason for this is that after 7 days that somebody has their virus, there is still a small percentage who can pass it on. And because care home residents and those receiving domestic care and so on are domiciliary care, are often at very high risk, then we think it's necessary to go to the 14 days, the extended. So nationally it's 7 days, but we recommend strongly that it should be 14 days. So they self-isolate. They should inform all of their household contacts that they need to self-isolate as well, and they should order a test. Ordering the test helps us know what we're dealing with, and if the test comes back positive, they'll be contacted by the National Track and Trace to identify contacts. As soon as the National Track and Trace service identify that the person works in a care home, they will pass that on to the local team to contact the care home to see whether there's been any transmission within the care home. So they need to order the test. The thing is, if they get the test back and it's negative, unfortunately there is this wrinkle which is known as the false negative. So some people actually have the virus, but the test comes back and says that no virus was detected. That's too high a risk, we believe, to reduce the self-isolation. So we say if you have a negative test, you need to complete your self-isolation. And there are a few exceptions to that. So if you have a number of people in the household who have symptoms and they get tested, and all of the people who get tested in the household are negative, that gives you more reassurance that the negative is a true negative. But outside that relatively rare situation, we would say don't rely on a single negative test. Thank you for that. The next slide. So what about if a resident develops symptoms? So firstly, what symptoms are we talking about? We're talking about exactly the same symptoms as you're looking for the rest of the population. But you have to be alert to the fact that in care home, even care homes for the elderly or those for learning disabilities and so on, they might not get the classical symptoms, and they might only have what are called the softer signs, and I've put them there. So shortness of breath, not being so alert, onset of new confusion, being off food, reducing fluid intake, even diarrhea and vomiting can be signs. So you have to be alert for these, and that's much trickier because those signs are quite broad, and many other things can cause symptoms like that. So you need to have a high degree of suspicion. If you are suspicious that somebody has symptoms of COVID, they might have the COVID virus, you think, you must isolate the individual, contact the health protection team, and I've put the number there to contact, and discuss it with them. If they agree with you, they will suggest that testing is undertaken, and that will be testing of the whole care home, so all residents in the care home, whether they're symptomatic or not, and all staff who are asymptomatic and turning up for work will be tested. And I've put the number of the organisation Comissio Primary Care Solutions, who will organise the testing and how to contact them. And that's me over for public health. Thank you.
Thank you, Danny. So just coming on to give you an update on personal protective equipment, PPE. So there's been a few changes to the way we're allocating PPE. It's changed how you pick it up, not the way that we allocate it. So we'd updated you to give you information on the collection locations. So currently PPE can only be collected from Witham and Colchester, and from Monday the 29th of June collections will only be from Witham, and the slots will be from 10 till 1. We can allocate PPE at the weekends, but we're strongly encouraging you to plan during the week. It makes it much easier for us. We've been using redeployed staff from services that are now back up and running, so we're having to move those staff back to their core roles. We're also finding that in general, most requests are coming in the week, so the support we were putting at weekends was taking up a lot of time for very little work. If you are in an urgent situation, and we can make weekend provision available, so don't worry about contacting us over the weekend. We're just encouraging you, if you can, to plan ahead. The current position is that we've also increased the supply that will be made available to you to a 14-day supply if you are unable to access through your normal routes. We were previously giving a 7-day supply, but due to the availability now, we're in a better position. We'd also encourage you to really manage your PPE proactively. Hopefully by now, with the guidance about utilisation, you're in a better position to judge how much PPE you need. It makes a big difference for us if we can have a few days notice, because it means we can arrange for you to collect in ample time, and hopefully that also enables you to plan your collecting around the hours of availability for collection. We appreciate in the early stages it has been quite difficult to calculate how much you are using and how much you need. We're hoping by this point you understand that a bit better, and obviously we've learned a lot in the last couple of months about how when people are needing PPE and how they should access it. We're also making some further changes which hopefully streamline the process a bit. So rather than needing to do a phone call, we will give you an email form so you can contact us directly. It's important that you use the form and go through all the data because it will make the whole process a bit smoother. And because of the changes we've made, you may not get a next day call on that. So again, if you can plan a couple of days ahead, it may take 2 working days from your initial request and to collect it. We're just to remind you, we're acting as supplier of last resort, so we'd strongly encourage you to try all the other options, so using your normal supply routes, because for ECC to try and kind of order on behalf of the market, we just feel we're going to get it wrong. There's so many providers, all with different needs. And now we've had a couple of weeks of running the national PPE portal. We'd strongly encourage those providers that are eligible, and you will have received a direct communication if you are. So it's for smaller providers of home care and domiciliary care. We were a little bit concerned in the initial stages because the national PPE portal was only giving 100 sets of PPE a week, but we've been advised as of last week that's been increased to 200 sets per week. So we're hoping that for most providers that will provide most of their needs. And just to remind you, if you're using that, there is no charge. So that's another benefit. All of the information has been updated on the provider hub, so I'd encourage you to look at that and just update yourselves alongside the information that we've shared, but continue to to come to us and request PPE if you need it, because obviously we do have availability. We're trying to keep around a fortnight supply of masks, and we have slightly more than that for gloves and aprons, and we'll keep that replenished while we're still needing to act as supplier of last resort. There's been lots of interest in the Infection Control Fund in the past couple of weeks. We have been very focused on the support to care homes. We will be moving on to working with the wider market in terms of access to the fund, and we'll update you further, but it's been a massive task to get the Infection Control Fund out to care homes. So just to assure you, 70% of homes have already been paid. 6% are not registered on the NHS National Tracker. Also, they have no beds on the tracker, and that's one of the key requirements to receive the money. So if you wish to access the money and you're not registered on the tracker, or you have no beds on the tracker, if you change that and notify us, then we are still able to make a payment. So although there was a deadline, we are able to waive that deadline. So if you weren't able to register in time, we're happy to continue to work with you. The key bit is to make sure, I think, if you're registered and you think you should be eligible for payment, is to make sure you have beds showing on that tracker. And we have a further 24% of providers who haven't confirmed agreement. So we're asking you to sign electronically, return the agreement, and that will trigger a payment being made. We're really keen to get this money out of the door. We want to complete this as soon as possible. So if there are any issues, if you can take the steps that we've just discussed, and we have been in dialogue with providers around any issues. We've also issued, in response to requests, some guidance on the kind of things that are allowable to be claimed, and a small number of limited exclusions. The feedback we've had is that that's been quite helpful. So that all of that information is available on the website if you're unsure about what is or isn't eligible. And then, as I said, for the remaining 25% of the fund, we're working on that because the scale of the work we've had to do with care homes has been quite significant. Our intention would be that that supports the market more widely. And then just to remind you again that we would strongly encourage you to make claims against the COVID-19 fund. This is intended to cover costs that aren't covered by other financial flexibilities, in particular for some of your PPE costs incurred in advance of the infection control fund becoming available and the national portal. You can make monthly claims. You can backdate to the beginning of the COVID period, which we're counting as the 19th of March. We are geared up to do fast turnarounds on those claims, and as this said, we can accept claims up to 12 o'clock on the Friday before the deadline. I know that one of the issues is that because this is council-related funding, the support is for ECC funded clients only, and is capped at 10% of monthly income. But would strongly encourage you to make claims that was intended to cover the areas that we've had feedback on that people were incurring costs. So please look at that and make sure that you're putting claims in for expenditure that's eligible. Again, we're very keen that the money gets to you in the market, and if there's any further support that we can give, then let us know. As usual, this afternoon we will be running a question and answer session on Slido from 2:15. You can start to upload your questions now. The code is as we've set out, and for those of you that haven't used it before, if you've got any questions, you can type your question, and in response to some of the feedback we'd had previously, we've increased the word count to allow for slightly longer questions. And if you want to see the responses, if you click on the arrow below the question, that will give you the responses. We will upload all of that information onto the website. So if you've and also obviously you can review the presentations at any point as they're uploaded onto YouTube. As Danny said, we're very conscious that we don't feel that the issues and the concerns around COVID are over. It's still a very active outbreak for many of you working in the sector. So we're very keen to continue the arrangements and the support that we have in place. We have stepped down some of the frequency of briefings because we think probably there isn't enough change on a daily basis for us to be communicating with you on a daily basis. We also thought probably in terms of the content of webinars, we didn't have enough that was changing on a weekly basis, so we've moved to fortnightly. We're also keen to do some further work in partnership with Essex, the Essex Care Association, to look at some longer term planning and how we respond to some of the issues that the COVID-19 pandemic has set out for the care sector and the council. So we're going to be having some further conversations about that. And ECA will be contacting you with a questionnaire so we can help shape some of those activities to support you as we go forward. So thank you very much for your continuing efforts. We do really appreciate it. We're very clear that as providers, you're very much at the front line of the pandemic and have been for many months now. So we thank you for your continuing efforts. All the hard work and dedication for you and your staff continues to be really appreciated. We hope that you're looking after yourselves. I flagged last time that mental health support is available through the ePut service, and we will look as we go forward about any other support that we can offer, particularly around your mental well-being and resilience. So thank you. I hope you're staying safe, and look forward to any questions later.